Hey, BC here for BC Nephro. I'm Dr. Brian Cronin, board-certified nephrologist and clinical specialist in hypertension. This week I gave the resident lecture on glomerular diseases. One of the common questions, areas of confusion, is when is it appropriate to do a workup for glomerulonephritis and what type of workup should be done. Specifically, we're talking about serologies, what type of serologies to order, and when to do a kidney biopsy. So my general framework for this is the following. First, figure out the differential. And once you figure out the differential, it'll become clear what serologies to order and if a biopsy may be indicated. So the differential is going to be based on the different clinical presentations. There are a number of different clinical presentations of glomerular diseases. I also like to think of the following. First, common things are common, so these should be in the differential, and also what conditions may be associated with the patient's known past medical history. I posted the slides for the lecture at bcnephro.com. I'll put a link in the description below so you can review the details. But now let's get into it. What are some of the different clinical presentations of glomerular disease? One is glomerular hematuria. So there can be isolated glomerular hematuria that is without proteinuria. And when this happens, you're thinking about IgA nephropathy can present like this in some cases, as well as something called thin basement membrane disease. Glomerular hematuria can also be associated with proteinuria, with or without progressive chronic kidney disease. And in these cases, you're thinking about things like Alport syndrome, membranous proliferative glomerulonephritis, and IgA nephropathy can also present in this way. There can be gross hematuria associated with glomerular disease, though this is more common with urologic disease. Some conditions, including IgA nephropathy, post-streptococcal glomerulonephritis, and C3 nephropathy, which is a variant of RPGN, can present with gross hematuria in the context of an infection. Next presentation, nephrotic syndrome. We're talking about nephrotic range proteinuria associated with edema and hypoalbuminemia. So some of the primary glomerular diseases you're thinking about here are minimal change disease, membranous nephropathy, and focal segmental glomerulosclerosis, specifically primary or idiopathic FSGS, and some variants of secondary FSGS, such as HIV nephropathy. Membranous proliferative glomerulonephritis and IgA nephropathy can also present as nephrotic syndrome. However, there more likely is going to be some degree of glomerular hematuria in these cases. Systemic diseases you're thinking about are most commonly diabetes and amyloidosis. Another presentation is proteinuria with progressive chronic kidney disease. Now, this proteinuria can be nephrotic range, but without overt nephrotic syndrome, that is without edema or hypoalbuminemia, or it can be subnephrotic proteinuria. Here you're thinking about certain forms of secondary or adaptive FSGS. IgA nephropathy and RPGN can lead to slowly progressive chronic kidney disease, but as noted before, these are most often associated with some degree of glomerular hematuria. Finally, another presentation is RPGN, that is rapidly progressive glomerulonephritis. This is going to present as an acute or subacute decrease in kidney function, decrease in GFR, with an active urine sediment, glomerular hematuria, and some degree of proteinuria. Now, there are three different pathophysiologic mechanisms. These include anti-GBM antibody, immune complex, which could be things like lupus nephritis, membranous proliferative glomerulonephritis, cryoglobulinemia, and some forms of IgA nephropathy. And then the third pathophysiologic mechanism is pauciimmune, that is ANCA-associated disease. When you have a patient present, look at the clinical picture, think of the common conditions, and think of the conditions associated with their known past medical history. So that's it. Thanks for watching. If you made it this far, you might as well hit like and subscribe. Check out the slides at bcnephro.com. Until next time.